y'all, welcome back to my channel. If you haven't been here before, my name is Julie and I mostly make content surrounding topics such as music, makeup, as well as mental health. Today's video is mental health related. I am finally bringing y'all back my Let's Get Clinical series, which I'm super excited about as it spreads mental health awareness. Now, if you're new to my channel, you may be wondering, why is this random person talking about mental health? Why do they feel qualified? Well, I have a master's degree in counseling psychology and plan to look for a job as a therapist soon, so I feel very qualified. And in fact, with today's video, we are going to be discussing generalized anxiety disorder. Many of you know this condition solely just as anxiety. We hear it all the time. I have anxiety, I deal with anxiety. But is dealing with anxiety the same thing as having a full mental health condition? No, it's not. So we're going to learn a little bit more about that today. I also feel qualified to talk about generalized anxiety disorder as this was the first diagnosis I was given as a kid. I've lived with anxiety my whole life and I was diagnosed with generalized anxiety disorder, I think when I was in 4th grade. So I was around 9 or 10 years old by the time I was diagnosed. But I do feel it was something I have dealt with for my entire life. But anyway, let's get into it, shall we? In order to diagnose someone with generalized anxiety disorder, you need to be a licensed clinician of some sort, whether that be a therapist, psychologist, or psychiatrist, etc. However, there are some diagnostic criterion delineated in the DSM. If you haven't seen this book here before, it is the Diagnostic and Statistical Manual of Mental Illnesses, and this is what clinicians alike use to diagnose their clients with mental health conditions depending on where they live. This is what we use here in the United States. According to the DSM, generalized anxiety disorder is described as excessive anxiety and worry, and they give this a term called apprehensive expectation. Now, this excessive anxiety and worry must occur more days than not for at least a 6-month-long time period about a number of events or activities such as school or work performance. Criterion A delineates that the individual finds it difficult to control the worry. So this is not someone who experiences anxiety, is able to cope with it and rationalize it and move forward. This is someone who is entirely consumed by their worry thoughts and anxiety symptoms, etc. Criterion B delineates that the anxiety and worry are associated with 3 or more of the following 6 symptoms, with at least some symptoms having been present for more days than not for the past 6 months. So going back to that previous criterion, it has to be within a 6-month time period and has to be fairly consistently awful for that 6-month time period. These are the 6 symptoms. Again, if you're an adult, if you're over the age of 18, you need to experience 3 in order to be diagnosed. If you are a child, you only need to experience 1 in order to have a diagnosis. They are as follows. 1, restlessness or feeling keyed up or on edge. 2, being easily fatigued. 3, difficulty concentrating or mind going blank. 4, irritability. Yes, so you're absolutely right if you feel irritable that sometimes it is related to anxiety. 5, muscle tension. 6, sleep disturbance, and they specifically describe this may entail difficulty falling or staying asleep, feeling restless, having restless sleep, or unsatisfying sleep as a whole. Moving on to other criterion within generalized anxiety disorder, we have the anxiety, worry, or physical symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. If you're new to these types of videos, this is almost always a requirement for every mental health condition. It has to affect the individual's life in some significant way where they are struggling to function and get through the day. It may not affect everything. Most of the time it does, but it's going to depend on the individual and the severity of their symptoms, etc. Next up, the DSM mentions that the disturbance in symptoms is not attributable to the physiological effects of a substance such as drug abuse or medication or another medical condition like hypothyroidism, because mental health symptoms can persist in medical conditions like hypothyroidism. And this is important when making a diagnosis because we don't want to jump to generalized anxiety disorder until we've ruled everything else out that could be contributing to the presentation of these symptoms. Moving forward, the DSM has a handy diagnostic features section where they get into more detail about these symptoms. The DSM discusses that adults with generalized anxiety disorder often worry about everyday, routine life circumstances, such as possible job responsibilities, health and finances, the health of family members, misfortune to their children, and what the DSM considers minor matters, which are household chores or being late for appointments. I'm gonna tell you right now, I am terrified of being late for appointments, but to be fair, I have generalized anxiety disorder. Children with generalized anxiety disorder tend to have a little bit different worries. Their worries are more age appropriate and focus on worrying excessively about their competence or the quality of their performance. This is typically school related. Throughout the progression of a generalized anxiety disorder in someone's life, the focus of their worries may shift from one concern to another. The worries associated with this condition are considered to be more pervasive, pronounced, and distressing, and they tend to have longer duration and frequently occur without precipitating events. So there's not always a logical and rational situation that occurs that would stress anyone else out and cause these things. Sometimes it's very minor matters that elicit an emotional response of anxiety or physical symptoms of anxiety. So the greater the range of life circumstances the individual worries about, the more likely they're going to get a diagnosis. And this makes sense because this anxiety disorder is generalized anxiety disorder. So it's worrying about all different things and all different possible activities and all possible aspects of life that could go wrong. I'm smiling because I relate, not because I think it's funny. I have really bad anxiety. Is it obvious? Okay. Anyways, so there's another helpful section called Associated Features Supporting Diagnosis. Here, the DSM describes that beyond muscle tension, trembling, twitching, feeling shaky, or muscle aches and soreness can occur as well. It's also common for individuals with generalized anxiety disorder to experience somatic symptoms such as sweating, nausea, or diarrhea. Now, I could do a whole video on somatic symptoms, but the gist of it is that these symptoms do not have a medical explanation, but they are something that is really happening to us, and it is a direct result of the intense anxiety we experience emotionally. Also, individuals with GAD can have an exaggerated startle response. This is very common within other anxiety disorders as well. Other stress-related conditions can co-occur along with generalized anxiety disorder. The DSM specified possibly IBS or headaches. However, they noted that autonomic hyperarousal, which is a big fancy psych term for accelerated heart rate, shortness of breath, and dizziness, are more so common in panic disorder than generalized anxiety disorder itself, because you do not need to experience panic attacks to qualify for a diagnosis of generalized anxiety disorder. Some more information about GAD is that the median age of onset appears to be about 30 years old. Children in particular tend to worry, as I said, more so about age-appropriate worries like sports or school performance, whereas older adults worry about their family's well-being and their own physical health. Younger adults also tend to experience more severe symptoms of generalized anxiety than older adults. Children in general tend to be overdiagnosed with generalized anxiety, so it's important to rule out other potential conditions prior to making this diagnosis. Children who experience this condition may also tend to seek constant reassurance and approval. due to their GED because they have so many chronic worries about their performance, and this can even lead them to becoming perfectionists in everything they do, which points to that they are unsure of themselves. So they are struggling with their confidence, self-worth, and self-esteem because of this anxiety. Hey, let's talk risk factors for a sec. So environmentally, there isn't much in research that points to this environment is going to result in generalized anxiety disorder. However, according to the DSM, 1/3 of the risk of experiencing generalized anxiety disorder is actually genetic. And these genetic factors have overlap with the risk of developing neuroticism as well. Neuroticism essentially is a personality trait. It means that you are an anxious person. It does not mean that you have generalized anxiety disorder, but it describes an aspect of your personality which puts you at risk of developing this condition. When it comes to cultural presentation, this is more so a note for clinicians, but many individuals from varying cultural backgrounds will often showcase physical symptoms. They'll have a lot of somatic symptoms, and that is what their unique experience with generalized anxiety disorder looks like, more so than the mental symptoms in other cultures. So it's important to look out for cultural differences. Now, I think you get the gist of what generalized anxiety disorder is, and I'm feeling pretty anxious. I'm sorry, I had to make the joke because it's true. Let's get into prevalence. Now, in clinical settings, generalized anxiety disorder is diagnosed 55 to 60% of the time in females, whereas in epidemiological studies, 2/3 of those participants were females. Females are often cited as being more likely to experience unipolar depression along with their anxiety, whereas it is more common for males statistically to have a co-occurring substance use disorder as well. However, depression in general, unipolar depressive disorders, this may be major depressive disorder, it may be persistent depressive disorder. Those are more often co-occurring mental health conditions for individuals with generalized anxiety disorder. Again, this makes sense because we hear depression and anxiety together a lot of the time. Now, getting into some numbers here, I found on the Anxiety and Depression Association of America website, the ADAA, cites that generalized anxiety disorder affects 6.8 million adults, or 3.1% of the entire US population, yet only 43.2% of these individuals are receiving treatment. Women are twice as likely to be affected by men, according to them, and they also cite the major depression that can co-occur along with GAD. Moving forward into the final part here, let's talk treatment for GAD. And I know this because I've been doing it since I was 9 years old. Treatment 1 is going to be medication. This is a personal choice. I do not want any medication shamers in my comment section. Please, if you feel you need medication to treat your mental health conditions, that is entirely valid. And if you do not want to use medication, that is valid too. But please do not dictate how other people do that. Anyways, SSRIs or antidepressants in general are most often used to treat generalized anxiety disorder from a pharmacological perspective. Moving away from medications, we have traditional talk therapy. I would suggest that anyone with GAD put themselves in therapy. I would specifically look for a therapist who does intensive CBT because CBT is going to be helpful for you as well. If you don't know what CBT is, I've talked about it in a lot of these videos. However, it is cognitive behavioral therapy. It is an evidence-based treatment in which we look at our thoughts, feelings, and behaviors and how they exist and are interrelated in some aspects. And by challenging some of our thoughts, it helps to reduce the intensity of our feelings and helps to shift our behaviors as well over time. It could be a very viable option for someone who has a lot of worries in their head, right? Beyond that, and I also found this from ADAA, ACT can be helpful. That's acceptance and commitment therapy, and there is a good amount of research on it. Relaxation techniques can be helpful, of course. You got mindfulness, meditation, yoga, exercise, whatever it may be. I am not saying these are cures by any means. I'm just saying that they are viable treatment options for an individual who's experiencing generalized anxiety disorder, whether they are a child, adolescent, or older adult. So there are a lot of options for you in treatment. I'm going to be biased here and also recommend DBT because DBT has changed my life. I love DBT. DBT is dialectical behavioral therapy. It is more so an evidence-based treatment for trauma-related disorders and especially borderline personality disorder. However, there are 4 key components in it that could be very helpful for someone who experiences intense anxiety from their generalized anxiety disorder. Emotion regulation could be helpful. Even distress tolerance for severe anxiety episodes could be helpful. There's a whole mindfulness component of DBT, so there you go. That's going to tie into what you need to manage anxiety. So yeah, there's just so much out there, and if you have this condition, you are not alone. It is probably one of the most common mental health conditions that I know of, and it's okay to reach out for help, and it's okay to talk about it and be open. And trust me, I've lived with it all my life. It's really hard to live with anxiety, but if you're doing it and you're crushing it, I am so proud of you. And that's all I have for you today. Thank you so much for watching. Please give this video a like if you enjoyed it. I'd love for you to subscribe to my channel as well. You can follow my socials down here. My Instagram is Julie_counseling. My Twitter is JulieCounseling with no underscore, and that is where I am the most active. My Facebook page will be linked in the description box down below as well. And I'll catch you on the flip side. Bye all.